Are you experiencing something odd and wondering if it could be an early sign of pregnancy? From sudden changes in your body to unexpected cravings, early pregnancy can be full of surprises. What if that missed period or those new food aversions are more than just a coincidence? Stay tuned as we reveal the key signs that might just confirm what you're feeling. Get ready to connect the dots and uncover what your body might be telling you. A missed period is often the first and most recognizable sign of pregnancy, especially for women with regular menstrual cycles. Typically, pregnancy occurs when a fertilized egg implants in the uterine lining, leading to hormonal changes that prevent menstruation. However, a missed period doesn't always indicate pregnancy. It can also result from stress, significant weight changes, hormonal imbalances, or certain medical conditions. When a woman becomes pregnant, her body begins producing human chorionic gonadotropin (HCG), a hormone that supports the early stages of pregnancy. Home pregnancy tests detect the presence of HCG in urine, usually a few days after a missed period, providing an early indication of pregnancy. In some cases, women may experience light spotting or implantation bleeding around the time their period is due, which can be mistaken for a light period. It's essential to consider other symptoms like nausea or breast tenderness alongside a missed period for a more accurate early pregnancy indication. Nausea, often referred to as morning sickness, is a common early sign of pregnancy, typically starting around the 6th week and peaking between the 8th and 12th weeks. Despite its name, nausea can occur at any time of the day, not just in the morning. The exact cause is unclear, but it's widely believed to be linked to the rapid increase in pregnancy hormones, particularly human chorionic gonadotropin (HCG) and estrogen. While nausea is a normal part of early pregnancy for many women, the severity can vary. Some may experience mild discomfort, while others might struggle with more intense and persistent nausea, sometimes leading to vomiting. In severe cases, this can develop into hyperemesis gravidarum, a condition requiring medical attention due to the risk of dehydration and malnutrition. Tender, swollen breasts are a common early sign of pregnancy, often noticeable as early as 1 to 2 weeks after conception. This symptom is largely due to hormonal changes, particularly the increase in estrogen and progesterone levels, which prepare the body for breastfeeding. These hormones cause the breast tissue to grow, leading to a sensation of fullness, heaviness, or tenderness. Many women describe their breasts as feeling more sensitive or sore to the touch, similar to the discomfort experienced before menstruation, but typically more intense. The areolas, the area around the nipples, may also darken and enlarge due to increased blood flow and hormone-induced changes. Additionally, small bumps known as Montgomery's tubercles may become more prominent. Fatigue is a prevalent early symptom of pregnancy, often starting in the first few weeks after conception. This overwhelming tiredness is primarily caused by the surge in progesterone, a hormone that supports the pregnancy but also has a sedative effect. Progesterone helps maintain the uterine lining and prevent contractions, but its high levels can leave women feeling unusually tired, even with sufficient rest. Additionally, the body undergoes significant changes to support the developing embryo, including increased blood production to supply oxygen and nutrients to the growing fetus. This process can strain the cardiovascular system, leading to fatigue. Lower blood sugar levels, reduced blood pressure, and an increased heart rate also contribute to this early pregnancy exhaustion. Frequent urination is a common early sign of pregnancy, often noticed within the first few weeks after conception. This symptom is primarily due to hormonal changes, particularly the increased production of human chorionic gonadotropin (HCG), which increases blood flow to the pelvic area and kidneys. As a result, the kidneys become more efficient at filtering blood, leading to an increase in urine production. Additionally, the growing uterus begins to exert pressure on the bladder, even in early pregnancy, causing the need to urinate more often. This pressure can make it feel like the bladder is full more frequently, even when the amount of urine is relatively small. Frequent urination can be particularly noticeable at night, disrupting sleep. While this symptom is a normal part of pregnancy, it can be inconvenient, especially if it interferes with daily activities or rest. Thanks for watching, and don't forget to like, share, and subscribe.